All right. Well, good morning, everyone. Welcome to today's COVID-19 vaccination town hall with AtlantiCare today. We are incredibly honored and grateful for the accessibility and opportunity to work with AtlantiCare on this very, very important town hall meeting. Today, we are joined by AtlantiCare's president and CEO, Lori Herndon, and the medical director of Division of Infectious Disease, Dr. Trivedi. As you can imagine, they are incredibly busy during this time. These are challenging times during the pandemic, but they have absolutely been leaders in the community for getting us information and being the first and last line of defense in the pandemic. So thank you all for joining us. Thank you all for submitting questions in advance. We have dozens of questions to get to, and I certainly want to make sure we give Lori and Dr. Trivedi enough time. So without further ado, I'd like to turn it over to Lori for some introductory comments. She's going to introduce Dr. Trivedi, and then we'll get right into the presentation and the Q&A. So thank you again. And Lori, the floor is yours.
Yeah, thank you, Michael, and thank you for the Chamber for hosting us today. I also want to do a big shout out for the business community who's been so incredibly supportive of AtlantiCare and especially our staff on the front lines. Our responsibility to all of you is to be available and to answer your questions and keep you educated as we've all gone through this journey over this almost a year now. I have the great honor of getting to work with Dr. Trivedi on a regular basis and wanted to introduce him. He is born and raised here in this community and actually got to work side by side with his dad, who was a cardiologist who's recently retired. He went on, was educated, actually graduated from Absegami and then went on to Cornell Medical School, residency in New Jersey, infectious disease residency in New York City, and then traveled the world, did a lot of very interesting infectious disease work, which if he had more time, I think you would really enjoy hearing. But the point here is he's incredibly, educated and a wonderful expert at a time when we needed one. He has been on the staff at AtlantiCare for several years now. And I love the fact that he met his wife here. He's married to a nurse practitioner. He has 2 children, and I've been trying to help him with his balance, but he has been on the go from the beginning and has just been a wonderful partner to AtlantiCare. He's in private practice, so he has his own business, but also, has been very supportive and engaged with everything COVID here at AtlantiCare. So Manish, I'm going to hand it over to you. We prepared a slide deck, which will really do what I would say is a little bit of a level set. We know you have a lot of questions, and he'll go through those, pretty quickly, but then we'll get to, I would say, the most important part, which is your questions, and hopefully be able to answer, them effectively. So, Manish, I'll turn it over to you.
I appreciate it. Thank you so much for the opportunity. And again, this is really an honor to be able to speak to everybody and answer questions. It's really an important topic. So as long as we can answer your questions, I think we'll feel really, really good about it. So so this is our COVID-19 vaccination town hall. If we could advance the slides.
Sorry about that.
Oh, no worries. So basically what I wanted to talk a little bit about was just a brief overview. I know people have a lot of education. There's a lot of information out there about COVID-19, so I won't harp too much on this, but a little bit of information just to kind of to lay some foundation for the vaccination portions of this. So COVID-19 was called COVID-19 or SARS-CoV-2 because it was first discovered in 2019. This was the 7th coronavirus that we know of. There's 6 others prior. There was SARS-1, MERS, and then some of the common colds. So when it initially was discovered, we thought this was a respiratory illness. We recognized that this caused a lot of respiratory symptoms, cough, shortness of breath, fatigue. But then slowly, as we started to discover more about this virus, we recognized that this had a lot of inflammation components to it. So it affected all sorts of other organs, and it caused a myriad of symptoms, a very wide range, from headaches, fatigue, sniffles, cough, to more serious effects on kidneys, heart disease. And so we had to kind of broaden the range of symptoms. One of the biggest things about this, that it affected all sorts of population. There was no age cutoff for it, infants to the elderly and everybody in between. The symptoms were more severe in certain populations that we noticed. People with diabetes, heart disease, these comorbid conditions, a lot of them were exacerbated. And so it was an uphill battle for some of those patients that had to go through COVID-19 as well as facing their own illnesses. Usually symptoms appear between 2 and 14 days, and that's an important note. So when you're exposed to COVID-19, you may be asymptomatic for quite some time and won't actually manifest symptoms until 2 to 14 days. And so when you have high risk exposures, having that buffer of 2 to 14 days, you have to really be mindful of that and maintain some sort of isolation. And we'll get to that shortly. So it's spread very easily. It's usually aerosolized, so it's from droplets from person to person. Usually close contacts, we tell people it's 10 minutes of close contact when you're not wearing a mask. What we're noticing now, and you've probably been familiar with in the news, there's variant strains that spread a little bit faster, more easily transmissible. And so we're starting to see that this may linger in the air a little longer. And so that 10-minute window might be shortened to even 5 minutes to 3 minutes. So the best way to prevent some of these exposures is to wear a mask. I can't stress how important wearing a mask is. I know it sounds like a very measly tool, but it actually is the best way to prevent COVID-19. Avoiding large crowds, of course, without wearing a mask. Maintaining a distance, usually a physical distance of 6 feet, should be adequate if you have to go into crowds or large rooms. And of course, washing your hands as frequently as possible. Of course, before eating, touching your face, eyes, washing your hands is one of the most important things. So how you diagnose COVID-19? Usually there's two different modalities. One is symptomology and the other is actual testing. You really want to diagnose through testing if you can. That will give you a positive finding. There's two types of tests that we use, something called an antigen test and a PCR test. Both excellent tests if you're symptomatic, both readily available through AtlantiCare throughout our community. So it's an excellent opportunity to diagnose. But from a physical diagnosis, one of the biggest hallmarks of COVID-19 is loss of taste and smell. So a lot of these symptoms overlap: allergies, common colds, the flu. But that loss of taste and smell is a hallmark to COVID-19. It's also one of those things that doesn't have to happen every time. So if you don't have loss of taste and smell, I still recommend getting tested through one of those modalities. The treatment, unfortunately, if you remain without significant symptoms, is just isolation. It's maintaining an isolation for about 10 days or so from the onset of your symptoms, and that should be adequate enough to rid the virus from your system. For those people who have worsening conditions, worsening shortness of breath, we certainly recommend you visit your primary care provider, come to the hospital to get more therapeutic options. Typically, those therapeutic options are oxygen and steroids. There's really no home run. I know in the news you hear a lot about different drugs and different opportunities. Really, they haven't shown great benefit, yet we still do provide those at our hospital. And as you noticed in the news as well, the cases are rising. I think due to the holidays and people spending time together, also isolating is really tough right now just because we've been doing it for quite some time. We start to get a little lax on our precautions, and I think we're seeing a lot of those consequences in the hospitals. You're seeing a rise in spike in surges of patients that have to present to our system. This is a great slide. It kind of shows what we've been through at AtlantiCare. Really from the beginning and the onset of the pandemic, you notice this kind of biphasic picture of how many people really presented to our hospital system to be admitted. And in the middle of the summer, we had a great kind of lull there. Everybody was outdoors, was able to maintain a physical distance. But as you notice around the holiday time, you start to see another spike in numbers. And I think that's going to be very telling. Right now, as of today, we're still at a very, very high number, higher than our first pandemic surge. But we're also at a plateau, I feel, and I think we're on the right and we're on the mend as long as we all continue to do what we need to do. Another great testament to what we've been doing is the availability of testing. I think in the beginning of the pandemic, there was a lot of concern about how can I get tested? How can I get results? And we started to meet those challenges by affording opportunities for people to get tested easily, readily, and fast. And the access to testing is demonstrated there. You know, we started testing only in the hospital with sick patients, but slowly we're able to open up the testing, and you're seeing like a great number of people getting tested in the outpatient setting. And that's helping us what we call contact tracing, isolating people who potentially have tested positive so that they don't spread to their loved ones and friends. So the big question, and I guess the big hope, is the vaccination. Vaccinations in general help prevent the spread of diseases. It's really, really an important tool to really combat most viruses and most illnesses. If there's a vaccine available, it certainly can eradicate the conditions that we're concerned about. Currently, and you're all familiar with, the FDA approved 2 products, both something called a messenger RNA virus or vaccine, excuse me, and that vaccine is readily available right now, and we're starting to ramp that up. But it requires 2 doses. One is the initial dose, and the other is a booster dose. So those two vaccines that are available, one is from a company known as Pfizer, and another company known as Moderna. Both are very, very similar in profile. Both are what's called messenger RNA technology. We can go over that later if there's questions about it. But the really big difference is how they're kept. The Pfizer vaccine is kept in very cold temperatures. It's because of the modality of which the messenger RNA is injected. It's in a very cold lipid that needs to be cold to stay stable. Where Moderna doesn't have to be so cold. It can be used in a regular freezer or maintained in a freezer. The studies really showed used patients that were age greater than 16. And so what we're seeing is Moderna was 18 years and older, Pfizer was 16 years and older. And again, both are 2 doses. One is 3 weeks apart, the other is 4 weeks apart. And so what we're trying to do is there's all sorts of prioritizing groups for vaccinations. It's really state mandated and government mandated as far as which groups are available to be selected. Initially, it was healthcare workers and frontline workers, and slowly they've expanded the groups. And as supplies become more rampant, they're able to expand the vaccination circle. And as of right now, I think there's very limited reasons not to get vaccinated. All the groups are pretty much expanded to a degree, including people with comorbid conditions, regardless of age, as well as smokers. So a lot of questions that I get just in general through the hospital and in the community are about side effects. People are nervous about the side effects of getting vaccinated. Typically, with both of these vaccines, the biggest, most common side effect is with any kind of shot. It's pain at the site. Whenever you get an injection or you get a needle into the arm, you get some swelling, you may get some localized redness and pain. In general, after you get the injection, some people suffer from headaches, some chills, maybe some joint pains, low-grade fevers as well, a general feeling of just not well. That usually lasts around 12 to 24 hours, after which all of your symptoms should resolve. If your symptoms still progress, I think you should reach out to a primary care provider as well. There is a possibility that you were exposed to other illnesses and you may attribute that to a side effect of the vaccine. Those usually resolve within that 24 hours. Now, it's really important to recognize the signs of an anaphylactic reaction. And the reason why is we need to address that very promptly. So if you start developing difficulty breathing, some swelling in your face, tachycardia, which is a fast heartbeat, body rash or dizziness, certainly reach out to your provider. When you get injected with the vaccine, typically there's a 15-minute wait period where you'll be observed over that 15-minute time span, so that if you do start to have any of those symptoms, it can be recognized and caught early. And as of right now, which is a great number, we've vaccinated over 55% of healthcare employees at AtlantiCare. We've distributed roughly around 6,500 vaccines, which is a phenomenal number. It's still not where we want to be. We want to be at 100%, of course, and in the community, we want to be at 100%. But as we continue to get vaccines and educate our staff in the community, we anticipate those numbers to go up. I'm going to open it up to questions. I know there's always questions when we do these types of town halls, and excited to answer those.
Yeah, Doctor, I've got a whole list of questions that people submitted.
Sure.
Let me turn on my video real quick. So just going back to the testing procedure, for what we've done, there have been a lot of questions about when to get tested, that 2 to 14-day incubation period, and then some people are testing too early and it's coming back negative. And what are the right tests that people get, because they hear PCR and they hear rapid, but some are more accurate than others, correct?
That's correct. You're right. So, the best time to test if you've been in a high-risk exposure is really to not test at all. If you are in a high-risk exposure, you want to isolate for 14 days. But in the reality of the world, it's really difficult to isolate for 14 days, especially while people have work and jobs and families to take care of. And so our recommendation is when you look at the curve of when people test positive, it's typically around day 7 to day 10. And so if you test around day 7 of your exposure and you have a negative test, we still highly advise you to isolate or remain physically distant from staff or people. But at the same token, wearing a mask during that time is really important within your own system. But 7 to 10 days is the most ideal. So a lot of people, they test early, they test day 2, the next day. That's way too early, and you're most likely going to have a negative test result. That doesn't get you out of the woods. You really have to wait those 14 days. Now, as far as the accuracy of those tests, you're absolutely right. If you're asymptomatic, the antigen test isn't the greatest test for that, but it's still very, very accurate. It's roughly around 85 to 87% accurate. The PCR test is far more accurate in asymptomatics. It's roughly around 95%. So those are the real distinctions between those. So if you don't have any symptoms yet you want to seek testing, typically the PCR test would be the most accurate, but an antigen test is equally well.
Well, thank you, Doctor. And with vaccines, there's 2 out right now. There's Pfizer and there's the Moderna one. How close do you think we are to Johnson & Johnson with and that's a 1-dose vaccine,
right.
correct?
Yeah, so Johnson & Johnson and AstraZeneca are 2 companies that are trying to do a single-dose vaccine. Right now, they're in phase 3 trials for that. Phase 3 trials basically means that we're trialing it out in a diffuse population, a large demographic to see reactions. We should gather that information hopefully within the next 3 weeks, 6 weeks, and then have that go into the FDA to present so that we can get emergency use. So we're anticipating within the next 6 weeks, 8 weeks or so to have that vaccine available.
That would be excellent. And then if I had COVID, how long is a person protected, I guess, from the antibodies from getting it again? If that's the right word to even use.
No, absolutely. You develop some antibodies from any illness. With COVID-19, what we're seeing, at the minimum, we're noticing that 90 days at least of protection from those antibodies. Some people, it stretches out even further, 6 months, 8 months out. We don't have more data just because we don't have more. It's such a novel virus. But at the same token, we're noticing that 6 months, 8 months, when they first did these trials of the vaccine, this was in early July, they're still noticing that those antibodies from the vaccines are still persistent. So that's a good sign that these vaccines may last a lot longer as well.
And if I had COVID, do I have to wait a certain time period to get the vaccine?
Yeah, so what we tend to tell people is because you have that protection, that 90-day window is the most ideal time. But if you have the availability and the opportunity, we really want your immune system to recover. We want you to fully recover from symptoms before you get a vaccine that may alter your immune system or rev that up again. So what we're telling people or suggesting is at least 30 days to allow your immune system to fully recover, that you're not symptomatic anymore, able to tolerate cough and go back to normal living. That would be the most ideal time.
And that's 30 days after symptoms, or is it 30 days after a negative test?
No, it would be 30 days after your symptoms.
Okay. Now, the vaccines, as of right now, do we know if this is going to be an annual shot or if it's every couple of years? Or are they still doing some work on that?
They're still doing some work on that. But what we're finding, and Moderna released a statement not too long ago about maybe recommending a booster vaccine a year or so later. That's really a preemptive kind of conversation. They don't know how long those antibodies will last, but I do anticipate a booster to be available. I'm not sure if that'll be an annual thing subsequently after. I think a booster at the very least, we can anticipate probably a year or so later.
Any advantages to one vaccine over the other?
Absolutely not. I get that question a lot. People have a lot of confidence in a certain company versus another company. Both use the same technology, both incite the same immune response. Really, it's not even a preference. It's just which one's available. The reason they're really different, and the only reason they're different is storage-wise. For the Pfizer vaccine, you need to have these special freezers that can cool the vaccine down to minus 70 degrees. That's not readily available throughout the country. So Moderna was able to do that, where you can keep it in a regular freezer, and that's really the only difference.
Okay. Somebody sent in a question. They had they had a reaction to a flu vaccine, and they're wondering if they're going to get a reaction if they get the Moderna or Pfizer vaccine.
Yeah, so not typically. Now, it really depends on your reaction. We always say if you've developed an anaphylactic reaction, you want to notify someone before you're getting this vaccine. If you have severe reactions in the past, instead of waiting that 15 minutes, as I mentioned earlier, it would be 30 minutes. We would observe you just to make sure that you're not experiencing any reactions. Typically at all of the vaccination sites, there is EMS personnel with all of the appropriate tools just in case something were to happen. But a reaction to a flu shot or other vaccines doesn't preclude you from getting this vaccine at all. It's a completely different technology, so you shouldn't experience similar symptoms.
That's good to know. What about autoimmune diseases or diabetes, pre-existing conditions that may elevate a reaction?
Sure. So this is like vaccine really is I mean, the first people to really receive those are people with pre-existing conditions. So heart disease, diabetes. Autoimmune is an interesting point because your immune system reacts very differently. Some people have a suppressed immune system. We still recommend it. We're not sure how much antibody you may create during those circumstances, but we certainly still recommend it. During the trials of both of these vaccines, they included people with autoimmune conditions. And they are following those out thus far. If 8 months out, they still do have protective antibodies, so it's certainly recommended.
And the question came up about, I get the COVID vaccine. It's not immunity. You know, there's a highly effective rate of this, but even if I get the vaccine, there is still a chance that I could get COVID, correct?
That's correct. And so what we're finding is, the end goal is a 94 to 95% effectivity. Now, what does that really mean? It means that you could still have a 5% chance of getting COVID, but you may also have very low grade, very mild symptoms. So there's 100% with these vaccines and not having to be hospitalized. And that's a very big, important key that you may still experience it. And because of that, you may still be able to spread it. So there's still not a substitute of just getting this vaccine and kind of eliminating everything until more people have access to the vaccine.
And how does that compare with other vaccines that we say, the flu vaccine? You know, these are 94% effective. How does that compare with what we normally get?
No, that's a great question. That's a phenomenal kind of number, 94 to 95%. Where with the flu, the flu is a very challenging virus. It's very easily manipulated, so it can mutate very quickly. So the vaccines aren't really targeted. This one is a great new technology that I think they're going to adopt to a lot of different processes. But it's phenomenal. It's one of the best. I know you've probably heard of measles and such before. Those vaccines were excellent as well, close to 95 to 98%. So this ranks up there with really high numbers.
It's great because a lot of people have sent in questions wondering about that comparison. I got the flu shot. What's that effectiveness now? Yeah. New strands of the COVID vaccine. Will these vaccines work against the new strands that we're seeing?
Yeah, and what we're finding is there's a lot of mixed data right now demonstrating that. Initially, they were saying, yes, there's several different variants. There's one coming out of the UK, which is the one I alluded to earlier about it being easily transmitted. We know that this vaccine is able to prevent that one. There's one in South Africa that's a little bit more, unstable, and that's the one that we're still doing research on and trying to find. That's as an epidemiologist in infectious diseases, that's the goal, is to try to beat that virus by vaccinating as many people as you can so that you can prevent that from spreading.
And when you talk about vaccinating as many people as you can, we've heard from the Department of Health that 70% of the state's population is a goal, to get to that number. Very aggressive, very ambitious plan to get to 70% over 6 months. It's something like 80,000 people a day. If we don't get to 70%, what does that mean? And do you have to get to that 70% in a certain time period?
Yeah, so, the 70% is, I don't want to call it an arbitrary number, but it's a number where it's what we suspect. If you have a majority of the population vaccinated, or let's say have immunity or antibodies, then at least that prevents, it's called herd immunity, prevents the others that didn't have access or were unable to get this vaccine, prevents that virus from penetrating that community. Now, the goal is, of course, to try to get vaccinated as fast as possible. There's a large number, and what we're finding in different states throughout the country is that there are people that have had asymptomatic disease. They've had antibodies already developed. So it may not necessarily be vaccinating 70%, but between the people that have recovered from COVID itself, plus those people that have been vaccinated, you really want to hit a high number. 70% is ideal in those circumstances, but it's not necessarily 70% need to get vaccinated. we need a combination of immunity in our community of 70%.
And then when we're looking at getting appointments for this, should they call their physician to schedule an appointment? Should they register with the state?
Yeah.
I'll email out the appropriate links after this to everybody that attended. What is your recommendation for that?
Yeah, so the process is starting to get more and more streamlined. I think people were frustrated initially with the process. The state allowed a certain number of vaccination sites within our communities, and so what ended up happening is the allocation of vaccine during that time was not as robust as we would have liked. And because of that, people logged on to the state, they registered, and then they waited for a phone call. The process, I think, will be a lot more streamlined once the link to the convention center is open. We anticipate a large number of vaccines there. We anticipate being able to provide to everybody who requests and needs a vaccine. There is a prioritization list in that regard, which people with comorbid conditions and really those conditions outlined by the state would certainly get priority, but that's the easiest way to go about it. When you log on to the website there, it's a quick registration process, roughly around 10 minutes or so, and you should be able to pick a date.
A couple questions about the registration process. If I don't really have access to computers or I have disabilities, how do they register? Is there a number to call or anything?
There is. That's right. There is a number to call, and then there is an in-person as well. So let's say you don't have access to a phone, you don't have access to that, and you have word of mouth. You can go in person. You can register there in person, and they'll set you up with a date and time as well. So really, the state and our facility, AtlantiCare, has done a great job of stationing people, really predicting those questions. And doing a great job with that.
Will you be able to go to the convention center and schedule an appointment?
That's correct. Yeah, we don't recommend to go in as a walk-ons if you have access to computers, but at the same token, if you don't, for all of those reasons you mentioned, you certainly will have that availability.
And others, if you have questions, please put them in the chat room. We've got a few more questions here that we'll go through, but if anything else comes up, any other thoughts as we're going through this, please put them in the chat room. We will have time to get to them. 65 pre-registered with the state. Also, should they also register somewhere else? I mean, that seems like a duplication that could create a enormous problem.
And that's what we're finding is that people initially, because they're really eager to get vaccinated, and I really applaud that. What's ending up happening is they're registering at, let's say, ShopRite, and then they're registering at one of the community pharmacies, and they're really registering all over, and hoping that one place will call you sooner. I honestly believe that once this site's available and open, you'll find it much, much more streamlined and a lot easier to get plugged in. So you won't have to register at multiple sites to get your vaccine.
Another good question. This touches on a whole nother point of COVID. Mm-hmm. People that are suffering severe anxiety about getting the vaccine, they want to get it. I haven't read anything where they can be moved up the list, but that ties into also maintaining health and seeing your doctor through this pandemic and not being nervous about that. Can you touch on that at all?
Yeah, no, there's a lot of apprehension. A lot of the questions that I get stem from rumors that have been circulating once the development of this vaccine. Well, people have told me, this vaccine's developed so quickly, how can we trust it? Or this affects pregnancy, it affects fertility. There's a lot of these rumors that unfortunately are not really true, and what ends up happening is that really compounds anxiety. Reaching out to your primary care provider, those healthcare providers have the accurate information, and of course, AtlantiCare offers a hotline number that you can call and really voice your concerns and get to the appropriate questions and answers.
Now, it's so important to maintain your health through the pandemic. I know a lot of people that I've spoken with were hesitant to go see their doctor because they were afraid that people with COVID or other illnesses, they would get it in the doctor's office. And that creates a whole complication afterwards for their existing symptoms.
No question about it. And that was a big struggle that we faced as a healthcare system initially. Like, we have a whole community of patients that we need to provide care for. We were able to establish telehealth appointments, and you can readily get seen through a computer, through a phone even. Our offices do that and do an excellent job of scheduling you when you need to be. So please don't feel like, and this is to the community, please don't feel like you don't have an outlet there. Reach out. There's always a way to be seen and get your questions answered.
I took a COVID test with AtlantiCare on Halloween, on the night of Halloween. The process was fantastic. I
Yeah.
mean, it was really, I was in and out of there in Summers Point in probably 30 seconds. The staff was great. So really, really great process. Couldn't be happier with it. And it was negative. So I like that. So with the Atlantic City, when do you think the Atlantic City Convention Center is actually going to be open to start vaccinating patients?
Yeah, well, we anticipate the links and the registration processes to be open hopefully today, if not tomorrow at the latest. And then you can kind of get plugged in. We should be up and running towards the end of the week and starting next week for sure. So help is around the corner with vaccination and just to kind of stay steady. You're probably seeing and noticing in the community these other centers and sites are unable to really procure vaccine right now. And I think it's because the allocation is really going heavily towards that convention center so that we can filter and funnel our patients through in a systematic process.
A couple of people have asked about the vaccine. It's still very early in the process of getting everybody vaccinated, but what's some data that they could look for evidence that's showing that this vaccine is working?
Sure. So both companies are releasing. There's a lot of journals that have done like subsequent studies on it, but they're releasing ongoing information. As they gather information, they're certainly providing that. There's different resources, and we'll have links to those at AtlantiCare's websites, just so that you can stay up to date with that. But what we are finding is those numbers are staying true to that 94, 95%, which is excellent.
Then switching gears a little bit, still on the vaccine, but younger people, fertility issues with the vaccine. I know I have a young niece that asked the question. She's actually a nurse. But what are you hearing about fertility and the vaccines? Is there any impact at all?
Yeah. So, this was like a big rumor that was spreading initially with vaccinations. There was a lot of anti-vaccine campaigns that were kind of pushing this forward. What we do know is that there is a protein called syncytin-1, and that's something that's linked to fertility with fetal tissue. There was some suggestion that was used in this vaccine. That's actually incorrect. There's no real correlation with any of that. On DNA, if you are familiar with the strands of DNA, there's sections of DNA that are shared with all sorts of different kind of things. There's a section of protein not linked to that at all that's in this messenger RNA, and I think those anti-vaccine kind of campaigns made that correlation, which is unfortunately false, and that's not true.
No, that's good information because I read that information as well.
Yeah.
Moving through the phases of people getting vaccinated, you have your healthcare workers, you have your essential employees, and as you move, what is the expectation potential date? Or do we even know that for 1C or beyond? I think my wife just scheduled, she's a teacher, and she has an appointment on May 1st.
Okay. Yeah, no, and the goal is to vaccinate as many people as we can, regardless of category, and that's going to be the key. As we kind of proceed, we really want to get those people at highest risk the vaccine if they need it first, and that's why we're really pushing forward to that. The goal of this convention center is to do that effectively and efficiently and timely. I don't think May 1st, I think that's a little further out than I would prefer. And I think what you'll find is those numbers will bump up much, much sooner once everything gets up and running.
And then we have, for AtlantiCare patients, should they contact their physician or should they go to the convention center site?
I think we're going to recommend it. So there's none of the physicians in the outpatient setting have access to the vaccine right now. It's really delegated by the state. So there's certain what we call point of distribution, certain pods throughout the communities that are able to vaccinate. What we're finding is a lot of those vaccines are being allocated to the convention center. So our recommendations would be to head to the convention center's website from the Department of Health website and be able to register that way.
And then we have some questions about the distribution process overall. I don't think it's as rapid as we initially had hoped. But what are you seeing in the communities with distribution? Is there, is it up to where we want it to be, and kind of how do we get there?
Yeah, no, I mean, the truth is, it would. I don't think no matter how the rollout would have been, it would not be up to how we want it to be. Unfortunately, it starts from manufacturing, and because the process of expediting this and approving this was so quick. Manufacturing didn't have an opportunity to really rev up production. And because of that, when they started to distribute the vaccine, we were using them at a rapid pace because there's a definite need in the community for it. We anticipate that as manufacturing kind of revs up, the distribution will be a bit more streamlined. Again, because of these quote unquote mega site centers, we're going to find that a lot of the distribution will be kind of taken to those sites. And it's because they're able to vaccinate a lot of people very efficiently. And I think that's what we're going to find moving forward, is that those sites won't be delayed from distribution, we're hoping. Those should be a steady flow. It's those other small points of distribution sites, those mom and pop pharmacies, the ShopRites, that may not have as much volume just yet because of those sites.
No, thank you for that explanation. It makes a lot of sense. Go to the chat room and move to some questions now. Now, one question is 70% of the vaccine, the 70% of the population we want to get to, that's the adult population, not the children population. And maybe we can talk about that with schools reopening and getting kids back into school. The impact of COVID on children. You're not seeing it as much as you're seeing it with adults and pre-existing conditions.
Yeah, it's a twofold kind of scenario. You're not seeing children get as sick or as rapidly decline at all. They may have sniffles, a cold, a couple days, and they're doing fine again. And that's great news. Unfortunately, a lot of parents, a lot of grandparents, they take care of their kids. And so what ends up happening is they end up getting sick from that exposure. We're finding that schools in the community, local businesses, they've all done an excellent job of doing the best they can to prevent the spread of the virus within their walls. And so I think as we kind of move forward, as vaccinations start to process, as people start to get those vaccines, those caregivers should be a priority. And I think they certainly should register on, so that they don't get kind of a secondhand infected, even though you're doing everything right. Your children who do go to school may have an exposure, and that could in turn put you at risk.
I think it's important for people to understand that a controlled environment, you're not really seeing spread. It's not impossible.
Correct.
But in a controlled environment, and where you're seeing spread are indoor gatherings, no masks, no social distancing, correct?
Correct. Yeah. And so, a lot of businesses and a lot of schools and such, they've put up safeguards to such a degree, and people really are being very serious and cautious about it. And those, I have to applaud them. You're absolutely correct. Those are the situations that you're not seeing the spread, but we are seeing where you let your guard down, where you're in a community setting, or you're in someone's house for a party or something, where you suspect, everybody should be okay. That's where things start to get a little tricky, because people stop wearing their masks. They feel more comfortable around each other, and that's when that issue becomes around.
Thank you, Doctor. And back to the vaccine for something a little more technical. Some have expressed concern about the use of fetal tissue cells in vaccines and their own ethical concerns.
Right.
Can you talk about how that applies to these vaccines?
No question about it. So both Pfizer and Moderna's vaccine, as well as Johnson & Johnson and AstraZeneca's, when they come out, do not use any fetal tissue. So there's for those people who have those concerns, for sure, there isn't a need to with these vaccines. They don't use those.
Excellent. We answered our question about the Atlantic City Convention Center. Do you have to be vaccinated in the county where you live, or can you register in another county? Some people are having challenges with Atlantic County, so they're looking elsewhere.
Yeah, well, I think because our kind of link isn't up and running just yet, I anticipate by hopefully the end of today and tomorrow, you should have access to that. But if you are registering elsewhere, you can register throughout the state. The only concern and the only recommendation I will say is you should get your second shot, because these are 2-dose vaccines at the same site. And the reason they do that is you're accounted for at that site. So we're recommending that you stay there, because your second dose will be delivered with your name on it, that will have you kind of processed through that facility. And so it's unfortunate if you were to go to another site and get your second shot, because that's somebody else's second shot that was kind of reserved for them.
And then back to the Atlantic City Convention Center for a second. Vaccinating, I think it was, what did you say, 2,400 people a day approximately?
Yeah, that's the goal, is to be able to vaccinate a significant amount. 2,400 is a great middle of the road number, even as high as 3,000, maybe even less than the 2,400, depending on distribution and allocation. So as soon as this starts to kind of run and rev, and we see some efficiency in the process, we'll have a better turnaround. But 2,400 is a good number.
Can I just add, Michael, just to interrupt, we don't expect 2,400 day one. As a matter of fact, one of the biggest frustrations we're having is we're geared up for 20, ready to go. And we are not going to see those numbers in the first few days for sure. And I just want to make sure everybody, we reset our expectations, because lining up or, it's not going to be available, and it is nothing to do with us. This is really, as Dr. Trivedi mentioned, really coming out of the supply chain challenges. And I read yesterday that the governor is expecting 100,000 doses a week, which doesn't even come close to what we know the demand is. So I need all of you to help us, have a more realistic expectation of what I'll call the first, week or so. And again, would be thrilled to see those numbers bump up quickly. But we're watching some of the other mega sites, and what happens is they gear up for a much bigger distribution and do not get the vaccine. So that's going to be a challenge for all of us as we, get started.
That's a huge challenge, managing that expectation, because it's great that so many people want to get the vaccine, that the demand is there. So the education is getting out into the community, that people want to get it, they're starting to understand it better. But at the same time, you're not able to do it to the level that you want initially. We'll get there. But I think there's some concerns about gathering that many people in the convention center, and that building's giant. I worked there for 9 years. Creating social distance in the Atlantic City Convention Center and managing it safely is probably a lot, easier than people think, because of the amount of space you have access to, correct?
That's exactly right. And, we have the help of the National Guard, and we have our teams here just really doing an excellent job of maintaining those physical distancing and just having people there to point and so there's not a cluster of people. It's really well organized. You'll be pleasantly surprised when you visit, for sure.
I was there on Friday, and it is completely well spread out. It's up on the second floor. You will not be able to get up onto the second floor to get vaccinated without an appointment. And as Dr. Trivedi said, we will have a small function. Again, this is something we're learning from some of the other sites, but this isn't a place for 1,000 people to show up to schedule themselves. If we get to that, we will have to shut that down. So really the point would be is go online and register. Our site has not been added yet, and we anticipate it will be added in the next probably 24 hours. But there will be only a small number because of what I shared. We don't have the capacity to even dose, to vaccinate 2,400 people that first day. So there will only be, however many vaccines we have, which will open slots. And then what will happen is you'll come in, you'll register online, you'll come in, there'll be another registration step, and then you go upstairs. We have the elevators, the National Guard. We have 40 National Guard members who are assigned to this site for the next 6 months, and they will be responsible for, if you will, all of the administrative side of things. We're working with ACPD as well, as far as, any challenges that we may have. But it's very well organized. There's a process, to make it through with social distancing. There's things on the floor. We have the chairs all spread out in the, observation area. It's very well thought out. And as a nurse, I have no concerns about you feeling, worried that you're going to run into, this big crowd of people. You will need to park underneath the convention center, and you will need to take your own, at your discretion. Obviously this would be where you wouldn't want to be walking in with a whole bunch of people. So you're going to need to, distance yourself, which is what you've been doing. So this is no different than anything that we've all, been working on. But this is a very, a great opportunity for us in this community to have access to the vaccine. So excited to get started.
Tremendous opportunity to be able to do this. So this is great. Pharmacies, are they going to start getting vaccines to vaccinate people?
Yeah, and they're going to continue to get vaccines. I think what we're seeing is once the distribution kind of equilibrates, and once we get everything from the mega site kind of up and running, you'll see that trickle into those pharmacies as well.
And then I think I know the answer to this, but can you test positive from receiving the COVID vaccine? Should you avoid travel for a period of time after receiving the vaccine?
Yeah, so the vaccines don't use what's called live virus. So you won't test positive once you receive the vaccine, unless of course you've had exposure to COVID or you are currently sick with COVID. After our first vaccine, we noticed that some people had side effects that lingered on for several days. Those people we ended up testing, and they tested positive. And it's not surprising there was an exposure a week ago, 2 weeks ago, and that's when they started to manifest symptoms of COVID. So the vaccine itself shouldn't preclude you to getting COVID. You shouldn't test positive in those circumstances at all. As far as travel is concerned, you won't be effectively vaccinated to that 94-95% mark until roughly around 4 weeks after your second shot. And so we really would, I would say if you have to travel, of course, use the same precautions you've been doing all along, wearing a mask, physical distancing, even after the vaccine, to do that as well. But you'll feel a little bit more comfortable after that 4-week mark.
Another allergy question here, but this is related to medicine. Penicillin allergies. I'm actually allergic to penicillin. So if I have a penicillin allergy, is it safe? And then bee stings.
Yeah, so both are, yes, they're safe for it. There's two certain chemicals, polysorbitol and polyglycol. Those are the ones that if you have an allergic reaction to those in the past, those are the ones that I would be most concerned about. But penicillins, bee stings, other medications, likely no. There shouldn't be an interaction or issue. That being said, our advice is if you do carry an EpiPen for any allergies at all, notify your healthcare provider, but also when and if you decide to get vaccinated, to just notify your vaccinator so that we can observe you for a longer period of time. I've had multiple patients of mine that have already been vaccinated that have a myriad of allergies that include anaphylaxis, did very well after receiving that vaccine. So
that's good news. Doctor, if their patient's been discharged from the hospital, when is the patient deemed not contagious with COVID? I guess that can extend to any person with COVID. When are they not contagious?
That's a good question. So what we tend to say is it's 10 days from the onset of your symptoms is when the life cycle of the virus really stops. Now, it really depends on your symptoms. If you have a critical illness, if you're in the hospital for quite some time related to COVID-19, we extend that to even 20 days. And so depending on your illness, it's 10 to 20 days. Most people in the community aren't sick enough to be in the hospital per se, and those are 10 days. Now, when we say the onset of symptoms, unfortunately, a lot of people have a little confusion with when their onset was. So we tend to tell people if it's the date of your positive test, that's when you really decided you had symptoms, let's get tested, and extend that 10 days and should be okay.
And even if I still have symptoms after that 10 days, is that still considered not contagious, or is that where you go to your 20?
No, and so even if you have symptoms, those symptoms, if you're well controlled, so a cough, for instance, or loss of taste and smell, those are some of the last things to kind of resolve. Your cough can linger for 6 weeks, 8 weeks. Taste and sense of smell, that can be 3 months even. So it doesn't mean that you still have the virus there. That sometimes tends to be the last things. But if you're still having low-grade fevers, malaise, fatigue, then I would extend that to that 20-day mark.
This is a group question. It's a pretty good question. Well, public transportation drivers, do we know what group they're in? I mean, we might have to dig into that a little bit, but I'm not sure off the top of my head.
No, I'm going to have to look into that. We know that they're considered essential workers, and so we would certainly categorize that in that circumstance. But I'll see what the government's categorization is with that as well. But a great question. Under my opinion, is they're certainly essential workers, and so should be up there.
We touched on some autoimmune diseases, we from what you suggested before, but this is one specific to lupus and the vaccine related to lupus.
Yep. So you shouldn't have a flare with lupus. There are some people that are on specific medications for lupus. A lot of people take steroids. There's other drugs, immunomodulators that patients may take. My recommendation, of course, is if you're taking an immunomodulator, if you're taking suppressive steroids, you're still a candidate for the vaccine. It won't cause a flare of your underlying conditions, but your immune response may not be as robust. And so you still want to take all the precautions. Don't feel that you're at that 95% and everything like that. You really want to still take those precautions, but it's a recommendation, and you shouldn't have a flare. During those studies, they did study lupus and rheumatoid arthritis patients, and they did well. They didn't have a flare.
No, that's great. A lot of questions coming in about the registration link. As soon as I get the registration link from AtlantiCare, we'll make sure we share it on our social media channels. We'll make sure we push it out through email. I'll share it with the city of Atlantic City. We'll make sure everybody on this call, everybody that registered to attend, has those links and phone numbers to call to make sure they're able to register when that link is available.
Michael, can I just clarify, that is not going to be an AtlantiCare link. That
Oh,
will
excuse
be
me.
a state link that is already available. So some of you probably have already registered. So there won't be a different link. What I'm told is going to happen is once the state opens our registration for the convention center, you will get an email, or again, there's been lots of glitchy IT. Perhaps you won't get an email. You're definitely not getting a phone call. I'm almost 100% sure of that. What we don't have insight into, and we will very quickly, is how you know, like if you're already registered, how do you know that, at 10 o'clock tomorrow morning, the Atlantic City Convention Center is now available to you? I still don't understand that process. It has not been clearly defined to us. So the thought would be, you're going to need to be checking that. And I also did see that the state, there is going to be a phone number. I read it in the Atlantic City Press this morning, that there will be a person, but not until next week. So there'll be there's a call number, but there won't necessarily be, it won't be adequately staffed. Maybe it's staffed, but it won't be adequately staffed until next week. So there's still, I think, going to be a tremendous amount of frustration and anxiety about trying to get into the queue. And again, just want to reemphasize to everybody, we are not going to have 2,400 doses, on Friday or Saturday. We are not. So there will be a very small trickle of vaccine that is coming into this community. We will do everything in our power to get it in every arm we can. So I don't, it's probably a little luck, a little of, IT knowledge. And again, that's really difficult for people who aren't savvy or, how to keep, trying to link in, but we'll do everything we can to, speed things up as soon as we get vaccine. I'm tremendously concerned that there's going to be a huge appetite, which is wonderful. We're thrilled. That, as you heard Dr. Trivedi said, this is what we have to have, but we will not have the vaccine, and we will be following the state protocol of how we, bring people in and how the vaccine, the questions that you answer will be how you'll, get directed. So it's not going to be fun and easy this first week, but we have to get through it so that we can then start, if you will, rev up the engine, and hopefully the vaccines will start to flow from the federal government.
Well, thank you for that clarification, Lori. I appreciate that. The convention center, someone asked if an elderly person is able to drive the convention center, but not able to walk a significant distance. Is there any assistance there to help to get them to the rooms? I'm familiar with the escalators and the elevators, but.
Yeah, we're going to have some, there will be wheelchairs and there will be staff. Some of the National Guard are going to be designated to provide some assistance. My only frustration I think it's so well thought of, but it's really for very, ambulatory individuals. Anybody who's frail and has, mobility issues, this is going to be a little bit of a challenge. And, but we will have people assisting them. And just so you know, I am asking for clarity to our state about how AtlantiCare and other providers are going to be able to support people who can't leave their homes, can't get, are not going to be able to navigate, getting in parking and getting into the convention center. So that's still an unanswered question. We will not, AtlantiCare does not have vaccines sitting somewhere for our patients, our frail elderly patients. We do not have any. We are finishing up our, the first responders. We were asked to go ahead and extend our efforts around first responders, which we've done. But we have 13,000 patients that are over 75. We do not have vaccines for those patients that are associated with AtlantiCare. I'm incredibly anxious and focused on trying to get a stream of vaccines for them. But as Dr. Trivedi said, the state has decided that these mega sites and there are other sites that have been approved will be getting vaccines. So this is going to be the tough part through these next few weeks, because everybody's wanting, their mother, their sister, their, fill in the blanks. Everybody's so anxious to get people scheduled, but we will not have the vaccines to meet that expectation, sadly. But again, optimistic, like we have to get through this phase to get going.
Yeah, thank you, Lori. An isolation question. I've been exposed 6 feet, 10 to 15 minutes is the number. Is that isolation process or the quarantine process 10 or 14 days?
So it's going to be 10 days. But bear in mind, if you're with people, you're both wearing a mask, and then your mask hasn't come off, you maintain that physical distance, you're at a lower risk for exposure. But let's say you both weren't wearing a mask, you were very close by for 10 to 15 minutes. That's a higher risk, and that's where we would say 14 days.
Okay, thank you for that. I run into a lot of that with youth sports as a volunteer coach, where a parent of a child may have been exposed. We cancel the practice. We keep everybody away until we have results. It's actually going on right now. I'm actually quarantining until we hear from the parent's mother. So it's better to be safe than sorry. Err on the side of caution, I think is the way to follow that, correct?
Yeah, that's right.
And then, one more question, about elderly patients again and getting them vaccinated. It's really the registration process, correct?
That's right. Yeah, and that's going to be the key with elderly patients is the registration process through the links or even using that phone number if feasible. The question about having frail patients being seen or traveling, navigating through that. There are those availabilities from ShopRite pharmacies to MediLink community pharmacies, and so all of these other pharmacies are certainly trying to facilitate that. It's just about the allocation of the vaccine.
That's great. And we'll take this last question, and then we'll open it up for any closing comments from Lori or Dr. Trivedi. Any programs or organizations that are helping people who may not be internet savvy or have other technology issues? Is there anything out there that's helping them register for or to get a vaccine?
Yeah, and so really it's that similar to what we mentioned earlier is that published phone numbers that will be there. We don't want a whole bunch of people walking in, but those people that can kind of get to the facility in that regard. If you can't leave the home, if you can't travel very, very far, those are the patients that we're concerned about. Those are the ones that we want the community pharmacies and areas, those points of distribution to be able to facilitate. So those of us who can navigate through a mega site scenario, we certainly recommend you do that to free up some of the vaccines in the community for those other patients.
I think what will happen, Michael, is many of our social service partners will see this as an opportunity. And there are numerous organizations that I know will be, stepping in. We will be doing as much as we can with our, frail elderly patients. But again, it's not an immediate switch. And I know I've heard from a lot of community members, they're helping their family members navigate the system, which probably in the beginning is what we're going to end up having to do as more and more of the social service organizations gear up for how to help and how to assist.
No, absolutely. This is actually last question, but this is a good one. Volunteers. If you have people that want to volunteer, because you hear rumors and stories about you need help with vaccination, getting people places. If somebody wants to volunteer, can they? To help?
Well, right now, what we're really still looking for are vaccinators, and those are registered nurses or paramedics with a state New Jersey license, and they can contact the county site, the county, if they're willing to step up and volunteer. We're looking for, we're not looking to have people do just one shift and be done. So we want people, because we need to teach you, all of the ins and outs about how to do part of the registration, answer the questions, absolutely do the vaccination. Actually doing the shot is the easiest part of all of this. But we don't right now, we don't need what I'll call, lay volunteers. But we do have, as I mentioned, at least for, as far as I'm clear, is that the National Guard will be at our site, at this community site for the next 6 months. If anything changes, we will get the word out because there are many people who are eager to help and be a part of this. I volunteered. It's a wonderful experience to give of some of your time to help, with this. It feels great to be a part of the solution to this awful experience that we've all been a part of. So, and Michael, what I'll do, if anything changes on the volunteer front, I will get in touch with you, and I'm sure you have an email list. We could get the word out quickly. So it's still vaccinators. We're still looking for some vaccinators.
Is there a training process to have a vaccinator, or how long does that take? Or
yeah, there's an online process, and depending upon the individual personal assessment, what we need to do. if for us to get to 2,400 vaccinations a day, we need 20 vaccinators for, and we're going to end up with pretty much a 12-hour shift, which there'll be an hour setup and an hour breakdown. So a 10-hour, if you will, with patients is the goal. Again, that will not be where we start if we get open, in the next few days. We could gear up if we had the vaccines, but we don't yet. So it'll be quite an operation once we get going.
Yes, it will. Yes, it will. Well, again, Lori and Dr. Trivedi, thank you so much for your time today, being so accessible, your leadership, your information during this tough time. Certainly want to wish you and your team all the best. I mean, the work you're doing, I can't believe it's been almost a year. We've been dealing with this pandemic, and it's going to be longer. I mean, it's going to take some time to get to where we all want to be, but I can't thank you and your team enough. So everybody out there, if you see a healthcare worker, thank them. I think it means more than you realize these days, the stress that they're under. So any closing comments from Lori or Manish? I want to thank everybody for coming, certainly.
Yeah. I would echo that. I can't tell you how hard everybody is working here at AtlantiCare and at Shore and at Cape and all of our, providers across the region. This has been a long, challenge, and people are tired, but they are so motivated. And obviously the vaccine did lift everyone's spirits, somewhat to, know that we have some control for our health and the health of our patients and our families. But we still have many more miles to go. And I want to thank Dr. Trivedi for all of his guidance and leadership. As you can tell, he's great to work with, and he's very knowledgeable. And we'll continue. If there's a need to have another one of these, in a few more weeks, we'll do that. But we do post so much information on our website. And again, Michael, if anybody has any specific difficult, I'm always accessible, and I can always connect somebody on our team if you have specific, concerns. So Manish, any final words?
No, I appreciate the opportunity. And, I want to thank the community as well. The community's done an excellent job of just really maintaining they're doing their part to help curb the pandemic as well. From inside the walls of the hospital, we do appreciate that, seeing people in the community wearing their masks, keeping that physical distance. It's a beautiful thing to see, and we appreciate that. So thank you.
Again, Doctor and Lori, thank you so much for your time and accessibility. It's great information. I will get this video out to everybody. Your questions were fantastic. I hope that you got the information out of this that you needed and can share that information with your friends to try and ease some of those concerns. And now you have good information to share. Thank you, Clem, Versutia Solutions, for helping us with our webinar today, and Town Square for running so many spots to get the information out about this. We couldn't have done it without you, and we had 100 people at one time on this call. So that's fantastic. And I'm sure we'll get a lot more on social media. So Lori, Dr. Manish, be well. Thank you, everyone. Wash your hands, wear your mask, be well. Take care, everyone. Thank you again for joining us.